Hi, my name is Dr. Paul. I am with the Body Intelligence Center, and I want to show you today about an exciting new technology. It's been around probably since the 40s. Actually, electrical stimulation has been around since prior to even hospitals. And with the monopoly of the industry in terms of medical, the AMA had tried to monopolize the whole health industry at one point, starting in 1920. But because of the amount of results that we're getting with vagus nerve stimulation, the results that we're getting is allowing the public to realize what benefits they're getting, and so they're demanding the use of these things. So one of the things that I found and that I've been praying for is technology that works. This works. The reason why it works is it affects the vagus nerve. The vagus nerve is going from the brain, it goes to the brain, it goes down into the digestive tract. It controls the brake of your body, which is braking from stress. If you're constantly gassing from stress and you can't brake from that stress, your body is going to be in constant stress mode, which is a breakdown mode. Vagus nerve is anti-stress, relaxation mode, digestion mode, rest mode. So it's pretty important to rest from stressing out, because if you don't, you're going to be breaking down. So this has been patented. They have close to 7 patents, at least 5. But I think it's even up to 7 or 9 patents on different things that it can do. It's been FDA approved for PTSD, emergency use authorization for COVID lung issues, because it opens up the lung passageway so that it would decrease your need to have ventilation if you have low oxygen in your body. It's been patented and approved by the FDA for migraines and cluster headaches and other types of headaches, but it has a multifaceted use. So I'm going to show you how to do it today. So you turn it on, and then you're going to put some gel on there. So you shake up the Renew 28, and you put it right here on the, as much as you can without it leaking off. Okay, and then I put my thumb on the plus button, and that turns it up. The minus button turns it down. So I'm going to put it right underneath my jaw, right over the carotid pulse, which you can just find that with your 2 fingers. Put your 2 fingers on your pulse, and that's where you want it. So, and I just kind of rub it in, and then I start pressing the plus button, and then right there it slows down the ticking, and I feel tingling between my ear right now, and if I move it down, I feel it in my jaw. So anytime I kind of move it slightly back and forth, so about 1/4 of an inch of motion here, and then right there, if I hold it right there, I feel that tingling continually. Hold it there, and it'll shut off in 2 minutes. So along with this are vagus nerve stretches. You don't have to do it, but I like to do a combination effect, because why not get the vagus nerve stretched out at the same time? So I bend my head, turn my eyes to one side, hold it that position for 1 minute, and I just roughly do it, or you can count in your head. And then, so this is a 2-minute timer. So I do it for 1 minute on this side, 1 minute on this side. And when I'm done, I switch to the other side. So if I do this wrong, it's going to contract my neck muscle right here, called the sternocleidomastoid. So I'm going to stop it just for a second. And right here, this muscle right there that turns that thick muscle that goes from here to here, you don't want to put you want to put the machine in front of that muscle, which is right there. See right there? It pops out, right there in front. So don't get it over that muscle. It's not going to hurt you, but it'll contract the muscle. And it's similar to like a muscle stimulation unit that many athletes use to stimulate their muscles. It's kind of the same technology. Actually, it's completely different technology because it's proprietary, but it's kind of the same feeling. Every electrical unit has different pulses or frequency, different kind of waves. This is a sine wave technology, which makes this unique. They have a proprietary frequency, and so therefore they have it patented for those FDA approvals. So I'm just going to go ahead and switch to the other side and do exactly the same thing. And you leave this on there, and I would wipe it down, okay, like this. So now the ASEA gel gets absorbed into the carotid artery. The ASEA gel gets absorbed into the whole body when it goes through the carotid artery. And then the Renew 28, which is the gel that I just used, is like a communication technology. It allows the body to communicate, to heal itself. It's like the fire. If your house is on fire and you need to tell the fire station that it's on fire, you use a cell phone. ASEA or Renew 28 is a cell phone. If you don't have a cell phone, your fire will abuse your home, cause it to get ruined. Your body gets diseased when it's not communicating correctly. It needs the cell phone with just Renew 28. That's why I do Renew 28, or it comes with a gel, the ultrasound gel. So I'm gonna wipe this into my neck, okay, on both sides. I'm not gonna do the other side for the sake of this video, but you repeat exactly the same thing on the other side with this. It turns off in 2 minutes. Do the Renew 28, do the stretching on 1 minute on one side, 1 minute on the other side. It'll beep, switch to the other side and do exactly the same thing. I'm Dr. Paul, and I'm looking forward to seeing you on the next video.